Is Benjamin Nguyen. I'm a student nurse here at the College of Nursing. Today I will be performing my central line dressing change checkoff. So I'm gonna go ahead and scan the room. All right. So the first thing I'm going to do is verify the order as well as hospital policy. I'm going to perform hand hygiene. I'm going to identify my patient using at least 2 identifiers. It's at this time that I also assess for allergies. So we have Jaguar J. Jones, date of birth 08/25/1963, MR number 4176352. They match up, and his allergies also match up. So Mr. Jones here is allergic to penicillin. So after I do that, I'm going to assess the site. I'm going to make sure to explain the procedure to the patient while providing as much privacy as possible. Then I'm going to assess the site through the dressing. I'm going to inspect, and then I'm going to palpate. All right. So I would gather all my equipment, which I already have gathered. I would position the bedside table onto the side that the patient's central line is on. Then I would move my equipment onto the bedside table. I would make sure the bedside table is also at waist level, and then I would position my trash can, perform hand hygiene. Now I'm going to raise the bed to a good working height, lower the side rails, and place my patient into a comfortable position with the head slightly elevated. So now I'm going to remove my kit. Make sure you guys can see it. So I'm going to remove the flap away from me first, exposing the mask. Now I'm going to put on my mask and then my goggles. So I got those on. Now I'm going to assist my patient to put on their mask. Usually, of course, their face or whatever wouldn't be right here, so I'm just simulating that. Now I'm going to don my clean gloves. Now I'm going to stabilize the old catheter and remove the old dressing by pulling in towards the insertion site. All right, so once I have that removed, normally there would be a bio patch in here too. Now I would assess the insertion site. I'm not going to palpate here, I'm just going to inspect, I'm going to assess to look for complications of the skin. If I needed a culture, sorry my goggles are fogging up. If I needed a culture, I would do it now. So I'm going to dispose of the old dressing in my gloves. I'm going to perform hand hygiene, and I'm going to open my kit, maintaining sterile procedure. Usually I would do this flap last, but the way it was folded, I had to do it first. But usually I would do the sides first and then this flap towards me. Making sure I'm only touching that 1-inch border. Making sure it's not hanging off the table, make sure I don't reach over. Now, I'll don my sterile gloves, and I will do that over here where you can see me. Check your thumb. Alright, so I got on my sterile glove. So now that I have done that, sorry, it's really annoying with these goggles fogged up. So now that I have done that, I will arrange the supplies well within my 1-inch border. I don't have any more big tegaderm, so I only have this small tegaderm. Hope that's okay. Okay. So now that I have that arranged, I'm going to clean the site with my swab here. I'm going to clean it according to hospital procedure. So I'm going to clean in a circular half circle motion, a rainbow, without crossing over the same area twice, like so. So once that's done, I will dispose of that. Now I will take my ChloraPrep. I don't know why I have two ChloraPreps. I would activate it by snapping it, and I'm going to pick up the catheter, stabilize it above the marker. I'm going to clean for 30 seconds going vertically, horizontally, and then in circular motions. I would also make sure to clean up on the catheter. And like I said, I would do that for 30 seconds. This hand is also now contaminated, so now I'm going to dispose of my ChloraPrep. So now that I have done that, I'm going to apply my BioPatch with my sterile hand still, with my sterile hand, whatever. I can use my contaminated hand to stabilize. So now that I have the BioPatch on there with the blue side up, according to hospital policy, I will apply the Tegaderm over my insertion site. Dispose of this well above waist height. And like I said earlier, this is a small one, so it's the only one I had left. So I would place it over the site like so, making sure it is smooth and that the edges are sticking. Then I would remove this, and I'm going to keep it because it has my label on it. So now I would write on the label the date, the time, and my initials. And then I would take it off. I would adhere it to the edge of the Tegaderm, not over the insertion site. So now that I have done that, I'm going to remove my gloves. Glove to glove, skin to skin. I will then remove my mask. Then I will remove my patient's mask. Then I would raise the side rail, raise the bed back to a comfortable height. I would place the patient in a comfortable position with a call light in reach. I would perform hand hygiene, and then I would document the site's appearance, drainage, type of cleaner used, tolerance, the date, the time, and the signature.